The placebo effect is something that has gotten a lot of attention in our field in the past 8 years even. And I can say that now there's really good studies out there that prove it's not placebo. There's indications from different studies that study certain points and their effect under functional MRI, resonance imaging. We have started to see that points that are classically known to help pain all over the body can talk to parts of the brain. For example, the L.A.4 on the hand is well known to move pain and affect pain everywhere. We have studies that shown that under fMRI imaging, it shows that the PAG, which is a para-aqueductal gray, which is a part of the brain responsible for the perception of pain, kind of turns the volume up on pain or turns the volume down on pain. This point that helps us decrease pain everywhere activates the para-aqueductal gray, the PAG, so it turns down the volume quite a bit. So this point, L.A.4, that's known to systemically treat pain everywhere, classically from our ancient texts 2,000 to 5,000 years ago, is now measured to activate a part of the brain that top-down modulates pain all over the body. So just because we didn't know the physiology before doesn't mean that the pathology isn't there. 2,000, 5,000 years ago, they had the knowledge at this point, treated pain all over. And now we can see in brain imaging that it really does, or kind of why it does. So it's interesting when people argue that it's placebo because there's studies now that prove that it's not placebo, and also placebo doesn't work in animal studies, and we have a lot of animal studies where that is profound. So it's an interesting argument, but I don't think it stands.
That's great. Do you believe that the effect of acupuncture, especially when it comes to pain, is cumulative? So if someone is dealing with a pain issue, and I draw the analogy to pills, so if someone starts taking pills for pain, until the body heals, that need for pills doesn't go away. It's not cumulative. It's not like you need less and less pills if the pain level is the same. How is acupuncture different from that?
I do think that acupuncture works in a cumulative effect, a lot like a workout. So if you go to the gym once, if you're training for a marathon, you're gonna feel better after that workout, but you're not gonna be ready to run the marathon or do whatever you're trying to do. It's the repeated going back that's really gonna strengthen the body from the inside out and change the way that it operates so that you can run that marathon in a really high performance way. Same with acupuncture. You can come once and feel different, and hopefully you'll feel much better after your first treatment, but it's not going to change the physiology underneath and kind of how your body is operating. But if you come repeatedly in a good treatment plan course, you'll see those changes and they'll stick longer. With pain medications, you're oftentimes just turning an alarm off. So you're just turning the symptom off and kind of having it be quiet, but you're not fixing the reason why it's painful. There's also has to be like a lifestyle change or some kind of mechanical change that needs to happen so that the stress isn't on that area of injury or area of pain, so that it's alleviated, and acupuncture can work to do that.
Pain is a subjective term. Everybody seems to have a different threshold for pain.
Yeah.
What may be painful to you may not be painful to me or some other person, or the other way around. And so could we say that acupuncture in fact helps you increase your threshold for pain so you suffer less? Is that an accurate statement?
I haven't heard that or seen that in a study or had seen evidence of that or looked at it from that perspective, but that'd be really interesting because I could definitely see how it could, because it turns off this brain discussion of your perception of pain, and so then you'd have a higher threshold and your pain perception might change too. So that's a really good, I'd love to see some research on that too.